The content provided in this podcast is for informational and educational purposes only and is not intended as medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.
Is it my story, your story, his story, her story, Jane's story, Joe's story? Is it just an allegory? Show's about to start and we still don't have a name for it. Pop, 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 pop. It's a long story.
Aging and cystic fibrosis are words you don't always hear in the same sentence, but on this podcast, you'll hear them all the time, with relevant discussions and unexpected explorations wherever this podcast might take us.
So many people with CF are living longer thanks to modulators and medical advances. We thought it was time to get into some real conversations with expert guests and people from all walks of CF about what living longer with CF means, the good and the not so good.
I'm Dr. Ahmet Uluer.
And I'm Lauren Harvey.
I'm a medicine and pediatric trained pulmonologist and director of an adult CF center at a Harvard-affiliated hospital right here in Boston.
And I've had CF all my life and was recently diagnosed with CF-related diabetes. I am committed to creating a supportive space for those with CF and their loved ones.
I will bring the medical expertise and provider perspective.
I bring the real-life CF experience.
And together we bring you It's a Lung Story, a monthly podcast about aging with cystic fibrosis, where we take a little time to tell a lung story.
It's a long story.
All right. Wow. I know that song is catchy. And so I think that the people who are listening to this are all singing that. They got a little worm in their ear with this song playing in the background. Welcome once again to another episode of our podcast called It's a Lung Story. I'm Ahmet Uluer. I'm a wannabe musician and more often a doctor who takes care of adults with CF, and joined again by our dynamic co-host and wannabe gardener, Lauren Harvey. And I did mention that because the other day Lauren was doing some gardening and she expressed how much she hated it. But we're also joined by our superstar producer and sage, cowboy poet, working her magic behind the scenes, Andrea Becker. Yeah. Yeah, you guys didn't see that one coming. This is no longer our first episode. And I know I said the first episode is the hardest, but I'm going to say now, I think the second episode is the hardest since you have to meet or beat expectations. And now we're facing pressures that we better have our beep together this time. I'm actually glad expectations are high. I think you guys are as well, because I know we're going to keep making this podcast a better experience for hopefully our more than one follower. And, I know that how can we do this poorly when we have such amazing people like Lauren and Andrea and our incredible guests? Yeah. Do you agree? I mean, I was looking for a response. I was looking for you to say like, yeah, yeah, exactly. Yeah. Last time we got to talk to Melissa Putman about CF related diabetes, and I'm not sure this is going to be a regular thing, but I just wanted to, mention one thing because, obviously we got some feedback about that episode. And one of the segments we talked about ways of mitigating blood sugar, especially early on. And we talked about diet and nutrition, but we didn't mention exercise. And so exercise is something we talk about all the time, and we'll talk about it hopefully today because it has such an impact on mental health. But we didn't talk about how exercise can affect blood sugars. And I'd be remiss to then not mention that we have a documentary film that's out. It's called 26.2 Miles Apart, and it's about 10 people with cystic fibrosis running the Boston Marathon in 2021 after 2020 was canceled. So they know how much we care about exercise because, that's, it's just the best way to slow down aging and also to take care of yourself and lead a better quality of life. So, we have a great episode for you today as well. And as we prepared amongst ourselves about the topic of mental health, I mean, it generated, right, a lot of discussion amongst us. And it just really cemented what I already knew. And that is, I get to work with two extraordinary people on this podcast, and not to mention the amazing people who are listening as well. So, thank you guys. No, you guys are the extraordinary ones. I'm just here like moderating and making sure we hear your voices. So, the topic of mental health is what we're talking about today, and it's a big one. And we have someone here joining us who is an expert in the field, a friend who I get to collaborate with, and co PI of a national study looking at the impact of modulators on mental health, and especially as people migrate from one modulator to another, ETI to VTI or VTD, or whatever we're calling it, or Trikafta to Aliftrek. So I am really so happy to be able to introduce you to and share this moment with Dr. Georgiopoulos, who has served as consulting child, adolescent, and adult psychiatrist at Massachusetts General Hospital CF Center since 2005. She leads clinical trials in CF mental health and palliative care. She's also chair of the CF Foundation prioritizing research in mental health. And so we clearly have the right person on today. Please help me welcome Anna Georgiopoulos to our podcast. Welcome, Anna.
Thank you so much for having me. I'm super excited.
I
And
know.
it's a hard act to follow coming after Melissa Putman, I have to say.
No, you're going to be great. And also, we're just glad. I mean, you guys get to work together as well. So we have, two colleagues coming back to back on podcasts. But before we get going, I just wanted to say last time I saw you, we were in Scotland at the European CF Society conference. I actually saw you one time after that, but let's talk about that time we ran into each other. And you were with the dream team of CF mental health experts. You, Beth Smiths from my hometown of Buffalo, New York, and Alexandra Quittner. And so you were with your mental health co-conspirators, and you guys bring such great energy. It was just so great to see you. And we were obviously there for the content at the meeting. But my first question is, everybody at that conference was about to go see Taylor Swift in Edinburgh. And I'm just wondering, are you a Swiftie as well? And did you go to that concert?
I did not, but I think about half the plane on the way back from Glasgow was Swifties. So,
And
and where my hotel was right outside of another venue. So there was some sort of like girl band from the 80s who had grown up, and everybody was like coming to that concert. So I got to listen to that concert for free out of my hotel window.
oh, no way. That is amazing. I mean, I think when we got there, guys, I mean, everything was about Taylor Swift. And I can't believe I didn't realize it. Andrea, Swiftie?
My daughter studied linguistics in college, and she actually had a paper where she analyzed the evolution of swear words in Taylor Swift's discography over time. She had course credit for that.
That is very cool.
Yeah,
Your daughter's very cool.
she is great.
Definitely. Lauren, and I know you're a big Swiftie. Oh, okay. All right. All right, let's get started. And we're going to start with a point that's brought up throughout the internet. If you go, you'll see people with CF bringing this up. And I wanted to just maybe preface this by saying the European equivalent of the FDA, the European Medicine Agency, or EMA, has placed a warning on their version of Trikafta called Kaftrio, where they talk about its possible association with depression, anxiety. And so we don't have that label here in the FDA, but it is something that our patients and the CF community talk about. I wonder if you can elaborate on that and just and the potential mental health side effects of modulators
Yeah, so every regulatory agency comes to its own conclusion about when to recommend labeling changes and things of that nature. So the European Medicines Agency did think that there was at least a reasonable possibility of a causal link between depression and Trikafta, or I guess Trikafta and depression, or Kaftrio in the case of the European label. And so, what we know is that starting in 2017 or so, we started to see case reports coming out in the literature. Back then, this was with Orkambi, but this has continued, as new modulators have come out and only accelerated as there's been more widespread use of modulators, of reports of new or worsening mental health symptoms. So changes in mood, like depression or irritability, increases or changes in anxiety, trouble with sleep, anger, neurocognitive problems like brain fog, memory trouble. And so we've been trying to sort out what's going on with that, and there are a lot of different possible explanations.
Right. I mean, Trikafta was approved in 2019, right at the end of 2019, right before the pandemic started. So, I mean, lots of confounding variables there.
Yeah, that's right. But for any individual, there might be multiple factors happening, or there might be different factors happening between different individuals. So, for example, we know that depression and anxiety are really common in people with CF. Even before modulators, the TIDE study, which was a study of over 6,000 people with CF around the world, showed that the rates of elevated depression screens and anxiety screens were 2 to 3 times what we would expect in the general population. So when you have a condition that kind of comes and goes, like depression and anxiety tend to, there can be times where it's a coincidence, right? I start a new medicine and I'm feeling worse, and it really had nothing to do with the medicine. But secondly, there can be psychological impacts of starting a new medicine that can be really transformative, right? And stress can be positive, but stress can also, positive changes can also be stressful, in a way that then impacts us potentially negatively. So that's another way that people could be impacted by modulators, a sense of, did I plan the way I would have wanted to for retirement? Did I make the choices I would have made in relationships had I known that I was going to be feeling better? And, how do I feel about feeling better myself when some of the folks I know with CF, weren't able to benefit or aren't eligible or aren't able to tolerate the medication? So those are some of the kind of confounding factors, and certainly the pandemic is one of those external factors that impacted all of us with anxiety at that time. Right. Right. Same medicine, different decision-making process about what the strength of evidence needs to be to say, hey, maybe we should start letting people know. And what the European CF Society guidelines now say that that when people are starting a modulator, they should be encouraged to tell their team about any changes they have that are physical or mental health related, right? Anything positive or negative, just like we do when we start any new medication. And also to screen for depression and anxiety beforehand, and then within the first 3 months after starting a modulator. So again, the Europeans have really come down on the side of this is something we really need to watch. And there are also some reasons to think that there may be direct impacts of modulators in a more biological way that are different than kind of the life adjustment or this is just my depression kind of coming and going. Well, the longitudinal studies that have come out since then, right, where like in Europe, again, they had more warning than we had that this medicine was going to be released, and therefore they were able to kind of get up and running with studies that looked at people beforehand and then afterwards for like maybe the first year. And actually, on average, people starting on modulators do tend to have either no change in mental health or actually positive impact. And that could be, again, a direct impact because we know, for example, ivacaftor binds to some of the same neurotransmitters in the brain that we use in medicine antidepressant medicines like serotonin, norepinephrine, dopamine, right? So actually there's some antidepressant effect, and we've seen that even in mouse studies, that there are mouse models of depression and anxiety, and mice actually tend to do better when they start ivacaftor. But we also know that some people don't tolerate those kinds of medicines, right? So there could be a subset of people who actually feel worse. And in fact, there also may be some changes that have to do with modulators' direct impact on CFTR. We know CFTR is found in the brain, and some of those channels that the neurotransmitters work on, like GABA, are chloride channels. So when we actually change the chloride balance, that may be affecting our mental health, again, for good or bad. So I think, to answer your question, though, about how we would manage that, we're looking for, is there anything about the pattern that's different than what I've experienced before? Sometimes people, if it feels safe in terms of their physical health, might try reducing dose or discontinuing for a brief time to see if there's any impact. But what we usually try to do is to say, is there any way to stay on the modulator if it's been helpful for you? So we would use the same kind of treatments we would anyway, right? Looking for support from friends and family, self-care, exercise, sleeping well, good nutrition, psychotherapy for depression or anxiety, right? And medications when they're appropriate as well that could treat attentional problems, depression, anxiety, irritability, any of the kinds of symptoms people could experience.
It's such a big struggle because we really want to keep people on these modulators that just the positive, clinical impact is just so great. So it is, looking at those, it makes sense to try to, treat just like anybody else, at least first.
Right. And these are decisions that, we really hope people can make with their teams to feel like they can, trust their team, that they're going to, if they say, I think this might be going on, this might be related, that you'll be able to have a good conversation together and decide together what the best course of action might be. Yeah, RETRIAL is a super exciting study that is just about to launch in the United States at 15 sites. It's sponsored by the Success with Therapies Research Consortium of the CF Foundation. And CJ Bathgate and I are co-PIs. And we also have a wonderful liver team. We have teams working on biobanking so that we can look at kind of biological correlates. But what we're doing is to think about those folks. Like I said, most people might do better starting modulators with mental health, but there's a subset who doesn't. And there's also a subset of people who can't tolerate modulators because of liver injury, right? Your liver enzymes start to go up and go off, and you have to sometimes stop the medicine. So we're actually looking at both of those groups. So for people who had to either stop Trikafta or reduce the dose and couldn't tolerate it, and now they're planning to try the new triple therapy called Aliftrek, which Ahmet was talking about a minute ago, right? Vanzacaftor, tezacaftor, dudivacaftor, or VTD, or Aliftrek. It's a once-a-day therapy, and we don't know how folks will do. Will they, there's a lot of hope, right, that maybe it will be different with this new medicine. Some of the ingredients are different, but we don't know that for sure. So those folks weren't part of the clinical trials that were used for approval of the medicine, right? Because if you couldn't tolerate Trikafta, you couldn't be randomized to either taking Trikafta or taking the new medicine. So those folks were by definition excluded. So we're really focusing in on if I had this problem before, am I at high risk? What is my risk if I start the new medicine? And closer monitoring of those folks to see how they do.
Yeah, this is a really exciting study, and we're trying to get people who do want to make that switch really make sure that they enroll in this trial so we can observe, any of these changes and benefits that we're hoping to see.
Right.
So on that thread, I wanted to shift to an Atlantic article by Sarah Zhang, and you were quoted in this, just to talk about the existential threat of survival. And, many people in the article, and there's another Boston Globe article as well, you're just talking about people not planning to live as long as they're living and to having a future. And so there's many things that are impacting them, like survival guilt, especially if they have a sibling or another family member who has passed away or is doing poorly. financial threats and other things like that. I would love for you to expand on that and the opportunity to be able to contribute to that article.
Well, and a lot of people have close friends on the internet as well, right? That they've made virtually and who really become really key supports in living with CF. Sometimes can feel like these are the only folks who really know what I'm going through. And so when people get sicker and are not doing well, maybe aren't modulator eligible, that can be really hard, and there can be a lot of survivor guilt, right? That like, why me? Why am I able to be here when when these folks aren't? And a lot of grief about that as well. So I think that article did a really good job talking to people with CF and their families about kind of what their experience was like, and how this can be a mixed bag, right? So it can be so much joy and ability to kind of run up the hill again and realize what you can do physically that's amazing, that maybe you've never even felt before in your life or not for many years, and mixed with some of those sad feelings of grief and feeling for other people who can't benefit. And then maybe having mental health side effects as well. So, feeling like, how can I choose between having all of this physical benefit and, having my mental health? If I'm feeling irritable all the time, or if I'm, having so much trouble with memory or word retrieval that I'm having trouble at work, right? How do I balance that? And that comes back to where it's really important to be able to work with your team and try to figure out how to make it all work.
Now, Andrea and Lauren, you guys are both on the modulator. Andrea, you're post-lung transplant. Lauren, you've been relatively healthy. So I just wanted to hear what kind of things come to mind when we talk about this. So
Right,
now,
but that can also lead to kind of minimizing what you do have to go through, right? If so then you can kind of invalidate yourself with, well, wait a second, but I still do have to do XYZ treatments and go to the doctor and do the things I have to do, and that's still, you
and,
know.
and deal with your CF-related diabetes. And I mean, you were somebody who responded to Orkambi, and so not everyone did. So that's why you sort of got like a start that was maybe ahead of others at the time. So anyway, we know that you would be able to be strong and do what it takes and be resilient, having known you already. Yeah.
Hmm. Mm.
Andrea, I know that if any of them would come here and tell you support you if you're whining about something, I think they would all be okay with that. No, thanks for sharing that, Andrea. It's really clearly important that we identify depression and anxiety. And I know we have ways of doing that, and they're not perfect. And I know that you just mentioned the TIDE study that Alexander Quittner was the lead on. And I was also part of the CF Foundation's, mental health advisory board with so many other amazing people. And so, what are your feelings about screening? And do you feel like we should do something different or any new recommendations? And maybe let us know what are the screening methods right now?
We've really come a long way in the past 10 years in regards to screening, right? We had no mental health guidelines in CF. And then the European CF Society and the CF Foundation formed a committee together, and we were able to look at the evidence, including the TIDE study, and make recommendations for screening. And now in the US, just about every single center is screening for depression and anxiety for people with CF starting at age 12 using the PHQ-9 or Patient Health Questionnaire 9, which is a depression screening tool that corresponds to diagnostic criteria for depression. So it's been well validated, used all over the world, translated into many languages, free for use. And then the Generalized Anxiety Disorder 7 scale, the GAD-7, is used for anxiety for people 12 and up. The guidelines also recommend screening parent caregivers of children with CF for depression and anxiety, because when a parent has elevated symptoms of depression or anxiety, their adolescent or also younger children in other studies are shown to have much higher risk for depression and anxiety. So the guidelines also suggest that when parents have elevated scores, we see how the younger kids are doing and make sure things are okay, or when there's any sort of clinical concern about younger kids. And then the other thing we're working on is a study called GEM-CF, which has been to develop a general mental health screener, because the guidelines do recommend, if there are concerns about depression or anxiety, to think about what else could be going on. Is there substance misuse happening? Is it general anxiety, or is there also anxiety around medical procedures, right, or medical traumatic stress or other kinds of trauma? There are all kinds of other, is there, ADHD, attention problems? There are all kinds of other mental health concerns that are actually common in people with CF. So in this study, we interviewed 60 adults with CF who talked to us about all the different kinds of mental health concerns that they've experienced, what they think should be in a screener like this, how feasible or useful they think this will be. Part of what we found was mental health side effects of modulators was a really big concern, and so that actually got peeled off into a separate screener. So now we have one screener for mental health concerns other than depression and anxiety, and we have another one for modulator side effects, and we have a grant under review. We hope we'll be doing a national validation study of those screeners so that we can see how they perform and get some of that data, again, in the modulator era about how common each of these kinds of concerns are in adults with CF. That's actually a really important point, right? It is a kind of written tool that you fill out, but it can be used as a kind of conversation guide. Sometimes when people are getting screened, there's not a conversation that's being had about those results, right? And sometimes people said, well, I didn't really need a conversation, everything was fine, but more people said, I really wish there was a conversation, right? So there's really not a lot of value in doing screening if we're not turning that into some sort of a conversation about how are you doing, what's going on, even if scores are low, right? What's going well? Looks like you're doing really well, and yet you told me this and that's going on. How are you so resilient? What's working for you, right? And that's another thing that we incorporated into this new proposal for the GEM-CF is to also include some hope and resilience measures as well. We really have gotten the strong message that we need to also be looking at strengths in people with CF and adults with CF, and to see how does that affect the relationship, right, between mental health and quality of life, right? If you have hope and resilience and optimism, does that change how your mental health will impact your outcomes?
I love that. This work is really outstanding. So, Lauren, you sometimes have to fill out these forms. What's that experience like? And I'm glad you mentioned it because that's something we deal with, right, Anna?
Yeah, for sure. I mean, that can be a signal, right? If you get all zeros, that's probably a signal like, don't want to talk about it, right? Because who of us goes around with like all zeros all the time? Probably not, right? There's probably not been a moment in the last week where we haven't felt anxious or something, not slept well or something, right? So, but I think that's okay, because also I hope that what doing that does for you is to say, well, but if I really am ever feeling bad enough that I do want to talk about it, my team is ready to have that discussion, right? If we never screened at all, then you wouldn't know that they were open to that, if they were open to that, or whether they were open to that.
Yeah, there's so many forms and questionnaires we're filling out, and that also there's a lot of fatigue from that as well.
Right.
But it's really critical that we somehow break through and be able to have these conversations. So, Anna, sort of shifting gears a little bit, and especially maybe thinking about our aging population, what are some interventions and ways that you feel like work best for helping people? I know in your article you talk about, cognitive behavioral therapy or CBT, family-based interventions, medications, and then also internal family systems. I don't know if there's something that you can expand on, based on some of the interventions that you've been, sort of behind.
Yeah, our mental health guidelines recommend, if people are having really moderate symptoms or above, that they first think about therapy, some sort of evidence-based therapy. So cognitive behavioral therapy is one form of evidence-based therapy. We have a program called CFCBT now. We've trained close to 250 clinicians in CFCBT for adults. We have an adolescent version as well, and an e-health version, and a group version. So that's one example where, again, we had people with CF help us with understanding, what was really important. How does helping prevent worsening of depression or anxiety, or treating depression or anxiety, how does that differ for a person with CF? And so we really designed that program around that kind of feedback that we had. But the most important thing is the relationship with the therapist. So regardless of what the theoretical model is, if you found somebody that you're comfortable with, then, you're probably going to get better. Things are going to go well. And if you meet with a therapist and you're like, I'm not clicking, this isn't working, then, then you go and look for somebody else who does get it. And of course, medications are also important, but we do have lots of different forms of therapy that are available.
Yeah.
Right. All of the above.
Do you find that access to that type of therapy? I mean, I know though there's, on a lot of different podcasts, they talk about these apps where you can be connected to mental health providers. Is access though still like a huge issue?
Yeah, access is difficult, right? Having insurance coverage is difficult. Having enough trained people available is difficult, and that's one of the reasons we've really focused on how do we help upskill CF care teams to be able to do more to prevent depression and anxiety or intervene, in the first stages to help keep problems from getting worse and help improve access for people.
Yeah. Andrea, what's on your mind?
One aspect of aging for women is menopause, right? And so for women during perimenopause and menopause, we know very little about menopause and CF, but we need to know more. But we know for women in the general population, right, that can be a time where people have hot flashes, they have trouble sleeping, they start to have some brain fog or cognitive trouble that might come and go as hormone levels shift. They might have irritability, increased risk for depression, right? And that's important because we can use usual treatments for some of those things, but there are also some very specific treatments now for menopause symptoms that are out on the market. And there are also the kind of good old, bad old hormone therapy, right? Which has been controversial at certain points, but probably does improve mood in women who are perimenopausal. And then for anyone who's getting older, right, all of us kind of think about cognition as we age. So what can we do about it? Take care of ourselves. Again, back to, Ahmet was talking about exercise before, right? Exercise is something that can help us reduce the risk of depression, anxiety, dementia, attention problems, all of those things. Good nutrition can do that as well. So anything that helps us care for ourselves and reduce inflammation is something that's probably going to help in the long run. Well, I think it's a topic we don't know enough about. There was an international randomized trial called Activate CF that was looking at all different kinds of outcomes related to exercise in CF, and they didn't really see much with depression and anxiety, but also the number was probably too small. So I think the evidence is so overwhelming in the general population literature about the impact of exercise for mood, for anxiety, for cognition, It can be a social kind of thing, right? If you're doing pickleball or kind of team activity. So there are so many benefits that if we could just write it on our prescription pad for everybody and pass them out, that's what we would do. For someone with CF, though, like if you aren't feeling great, I mean, it's hard enough to get ourselves to do something we don't feel like doing anyway. But if you really are having trouble breathing with it, right, or really low energy, then or if you're feeling depressed, right, it feels like a kind of double bind, like, well, I need to get really active to help with this, and yet part of the problem I'm having is that I can't get active. So how do we kind of bite it off in little chunks, right? Get ourselves to do just a little bit more every day or every week, so that we can build up some strength and endurance, and again, find the things that are fun to do that we're actually going to do rather than what we think we should do. I think walking is a great place to start, and there are good studies looking at that. And so, like, if you can just get up and walk around the block once, like, that's great. If you're someone who has a job where you're kind of at your seat all day, then if you can get up, for 5 minutes every hour, I mean, that's going to make a huge difference. Right? So actually, going from completely sedentary to any amount of activity is where you see the biggest boost.
As I look into aging, in general, and especially in CF, I mean, there's a lot of different things that are out there, but exercise is always the common theme. It's such a huge thing. And I was just going to bring up, I just saw a comic, went to a stand-up place, and this guy was talking about how he loves, like, that he's doing exercise and that his mental health is so much better. He's feeling great and refreshed. And then all of a sudden he realized, wait, I got to do this for the rest of my life. And like, and so that twist, I really feel like, but it is great. I mean, of course, we love exercising. I can't wait to exercise for the rest of my life personally. But that was really kind of a funny little punchline.
But if you don't enjoy it, can you pair it with something fun, right? So if you
Yeah.
do it with a friend, or like for me, I get on the treadmill last night and I watched Love Is Blind Habibi, right? And that was like so fun. So fun that I didn't
I
want to stop
love
and go to
that.
bed. So, I mean, you do what you got to do.
That, yeah, no. Hmm. Yeah. Anna, I mean, you brought up this point. It is really doing, and I'm sorry we didn't emphasize this right away. So, Andrea, such a great point. It is any movement. I mean, just really anything you can do. That's all it is. You just don't want to stop moving. You don't want to stop doing anything. And so, dancing with your dog, I think, is perfect. Well, one of the questions that we had was just about the family caregiver. There's burnout. We see divorce. We saw relationships change when people go on modulators and become healthy, and that caregiver, dynamic changes. Have you seen that, as a consequence of modulators or transplant? And do you work with family dynamics like that?
It can be both what happens in a parent child or adult child relationship, right? If somebody's really sick, they might need a lot of care. They might not be working. They might be very physically dependent on people. And, for caregivers, there can be caregiver burden, but there can also be a lot of reward in caregiving and a sense of purpose and meaning and closeness. And then if somebody gets better, whether through transplant or modulators, sometimes a caregiver can end up feeling like, what's my job now? What's my role? I'm not needed anymore, right? So there can be some, again, some of that stress that comes along with something that's positive, but actually you end up with kind of mixed feelings like, well, I don't get to see them as much, or I don't know what to do with myself. And so that can make for some tension. And, and that can also happen in relationships. Either the person with CF or the partner feels more freedom to say, like, this isn't working for me. So it really depends on the individuals. But yes, certainly family work can be really helpful for those kinds of situations. Right. Well, again, I think it depends on what's the quality of that relationship like, and not meaning good or bad quality, but just, what are the things that connect people? How do they relate to each other? What is it that gives meaning? Because there can, again, be folks who are in it for a long time, and that feels somehow sustainable to them. Maybe that's just coming back to this optimism or hope or resilience. And as people get sicker, if we're really talking about sometimes end of life, hope shifts, but it doesn't have to go away, right? So what you're hoping for looks different, or what's giving you meaning can be different over time. And sometimes, it may be that relationship needs some infusion of support of some sort. Maybe that caregiver could use therapy or more support from friends or family, or just feeling the permission to talk about it, right? Because sometimes you might feel like, well, I'm not allowed, like kind of like you were saying with survivor guilt. Well, I don't have it that bad, they'd love to be in my position. Who am I to complain that I have to, do more around the house, or more to take care of the kids, or have to work, or have to whatever, right? But those are the things that caregiver is experiencing, that, and they need some way to be able to express the stress and burden and fear, and anxiety that they might be experiencing, and kind of the pre-grieving sometimes as well. Like the anticipated loss is really hard.
So, Anna, what we want to do is we're going to ask you some rapid questions, some
Okay.
totally random, as my dog comes in and wants to share in this moment. And so it's going to be just quick fire, just whatever first comes to your mind. And so this is what we're doing with all our guests. So Melissa did it last time, and people are going to do it with our next podcast. So if you're ready, I'm just going to go with these questions. You
All right,
ready?
go for it.
Okay. Best way to cut a sandwich, diagonal into triangles or midline to create two rectangles?
Diagonal.
Which tastes better?
Diagonal.
Yeah, I guess that would be it. What was the first concert you attended?
Oh boy, that is probably Grateful Dead.
Oh, wow. That's amazing. That's a great first concert. Are you for or against insects?
Insects.
Yeah,
I'm pro. I don't kill them. I take them outside.
I love that. I love that. I do the same. What's your favorite rom-com?
I don't
Yeah.
know.
You don't know.
I don't know.
What do you like? What do you like watching?
What do I like watching?
Yeah.
Yeah. I don't know. Severance, not really a
Severance.
rom-com.
it's it's by
Love is
Ben.
Blind. Yeah,
It's a
yeah.
Ben
Bad
Stiller.
reality TV. Love is Blind. In every country, I love watching like how the dubbing works, and yeah, it's like kind of strange, geeky romance.
First of all, love Severance, and it's by Ben Stiller, so there's a little bit of a common there, and so love it. True or false? Andrea wanted to be a ventriloquist in college.
True.
Right, false. She wanted to be a journalist, but that would be cool.
I mean, that would be cool.
She probably wants to do ventriloquism with us. Window or aisle?
I used to be window, but now I'm aisle.
Okay.
That's getting older, right? I want to be able to get up, so I got to do aisle now. I
That's
used to,
aging
when
us
I was
up.
a kid, I wanted to look out the window and look at how cool it was, and now I just want to sleep or do my work and get
That
up.
is perfect. I didn't catch that. I didn't think of that angle when we wrote that. Ferret or pig as a pet? Or
Pig,
neither?
probably.
Okay.
My kids used to ask for a chinchilla and a pig, so, but not ferrets.
It's funny because chinchilla was one we were going to actually bring up. Train or plane?
Plain, even though
Okay.
not great for the, environment.
Yeah. So I want to end with the last one. What does DSM stand for?
Diagnostic and Statistical Manual.
Great.
And fun fact, the DSM 2, 3, and 4 use Roman numerals. But when you do DSM-5, it's not the V, it's the 5. We're going back to Arabic numerals now. So DSM-5 is not DSM-V, which you see sometimes published.
Yeah.
That is
Yeah.
incorrect. It's the 5.
And is there a DSM-6?
Not yet. There's a DSM-5 text revision.
I see. Okay.
So, we have updates, but not, brand new diagnostic criteria yet. But I'm sure there's a 6 in the works. There's always going to be another one.
Well, we were supposed to put a timer to this and we didn't because, but you got all the questions essentially right except for one.
Except for
So
the
you got-
ventriloquism.
And so you got, I think we calculated as 13,932 points so that you're going to be able to cash that in and we'll let you know what currency that's in. But thank you so much for being a good sport and playing along and not knowing what the questions were and answering them so honestly. And we really appreciate it. And we really appreciate the fact that you're the right person to call on to answer all these questions. You are right there at the forefront of what's happening with mental health. And we are so grateful that you made some time tonight for us. And just really from the bottom of my heart and all of our hearts, just thank you so much for being here.
Oh, it's my pleasure. Thank you so much for highlighting mental health. It's such an important topic.
When I go there and I talk to CF communities and ask them what they want to hear about, it's like mental health is the top 3 things that they want to talk about. So thank you for doing what you do because it's so critical.
Thank you for having me.
I'm just going to say, wow, that was really great.
That was amazing, too.
Well, first of all, DSM-5 going to Arabic numerals. I mean, that's huge. No, I think what she mentioned about the exercise and mental health, not what I thought. I thought there would be a massive correlation towards exercise and good mental health. So I found that interesting, and I'd like to see where the studies go with that.
And on top of that, I was surprised that there wasn't much research done on exercise and mental health. I feel like that would be something that a lot of people would focus on since, whether you have CF or not, you're told to exercise and that it's good for you. So I'm surprised they haven't done more studies on
Yeah.
that.
I mean, it was great to hear about all the clinical trials that are ongoing that are about to be, approved to move forward. RETRIAL, looking at people going from Trikafta or ETI to Aliftraq or VTI or VTD. I thought that's going to be a great trial.
It's hopeful to see all that work being done because it just doesn't feel like it was there, I don't know, 15, 20 years ago.
Yeah, like she said, this is really in the last 10 years. That consortium got together in the mid 2010s. And so thanks to the vision of, the people at the CF Foundation. And also we know that organizations like CFRI, there's a lot of mental health related content on their website as well. And so, I'm glad that we're paying attention to it because it's just so critical.
Until next
wait.
time.
Now,
Are
say
we
that again.
ready?
I'm ready. I'm ready.
Okay. Until
I
next
was
time.
ready.
Get a little older.
Live a little bolder.
Bye, everybody. Thank you
Pe-
for joining us.
Peace out.
Okay, bye-bye.
Bye.
We are working hard to provide meaningful information to a deserving CF community, information you won't find anywhere else. If you'd like to help us grow, we'd greatly appreciate it if you would follow us on Apple Podcasts, Spotify, or wherever you get your podcasts, so you never miss an episode. Want to go all in? Leave us a rating and a review. It helps people find us and makes a big difference. If you found this episode helpful, please share it with a friend, family member, caregiver, or provider who might also want to hear it. This helps you, it helps them, and it helps us spread the word to those who need to hear it most. It's a Lung Story is produced by me, Andrea Gavin Becker, and is hosted by Dr. Ahmet Uluer and Lauren Harvey. Additional editing and production support is provided by the team at Resonate Recordings. Until next time,
Get a little older.
Live a little bolder.